with type 1, gosh, 23 years ago, 24 years ago. He's 25. So I've been around diabetes a while. A lot of my family members have type 2. So this is about an hour long, or maybe a little less, depending on questions. Feel free to ask any questions at any time. Trudy's going to help facilitate those questions probably either at the end or during, I don't know. We'll just go for it. But I like to make this fun and interactive, so we'll try virtually. Were you going to say something, Trudy?
No, you're good. So
Okay, all right.
if anybody does have any questions, just put them in the chat box and I will facilitate that part.
All right, thank you. Let's start. So the first slide, can you guys all see the slides? Ah, I can't get it to go. Oh, there we go.
Yes,
So
we can.
a little humor, right? Let us come together, remain calm. This may be the tip of the iceberg. So a lot of people get anxious when you start talking about diabetes, but it really is easy to manage. So let's start with the next slide. So here you can see our biggest concern is that about 84.1 million people have prediabetes. So that's one about diabetes can lead to blindness, kidney failure, heart disease, stroke, and neuropathy, which is loss of feeling in your toes or feet or legs. So the good news, though, is you can cut your risk in half knowing that you have prediabetes by eating healthy and being active. So today we are going to talk about what diabetes is and prediabetes, what are the risk factors for diabetes, and how can we delay or prevent type 2 diabetes. So first of all, prediabetes can be a serious health condition where your blood sugars are higher than normal, but not high enough to get a diagnosis of diabetes. Type 2 diabetes means that your body is still producing the hormone insulin, but it's not able to do its job. We call it resisting, because over a period of time, your body gets tired and doesn't utilize that insulin the way that it should be. So what is insulin? I just told you it's a hormone. It's made in our pancreas, and its job is kind of like a key. It allows the glucose to get out of your bloodstream into your other cells for energy. Over time, like I said earlier, your insulin can get tired of working, and it kind of just sits there and says, I'm not going to do my job because I've been tired, right? So precursors to type 2 diabetes is being overweight for a long period of time, especially around your abdomen area. Having family members that have type 2 diabetes, it's very genetically linked, and some of our ethnicity. So here are the risk factors. If you're 45 or older, you're more inclined to develop type 2 diabetes. If you're physically inactive, less than 3 times a week. Family history we talked about. If you're at risk for having high blood pressure, had gestational diabetes when you were pregnant, or had a baby that weighed more than 9 pounds. And if you're overweight, we kind of already talked about that. If you feel like you have some of these risk factors, it may be in your best interest to talk to your doctor about it and get some blood work done. On the next slide, here is a prediabetes risk assessment. So if you have some paper wherever you're at in your home, let's kind of pay attention to the questions and we can add it up and see if you're at risk for developing type 2 diabetes. So if you look at your screen on the top left, there's a little test. I'm going to ask you if you, some of these questions, and the numbers are off to the left. If it's yes, you get 1 point for the first question, 0 for no, and so forth. So number 1, are you a woman who has had a baby weighing more than 9 pounds at birth? Yes, you get 1 point, no, 0. Do you have a sister or a brother with diabetes? 1 point if you do, 0 if you don't. Do you have a parent with diabetes? 1 point if you do, 0 if you don't. Find your height on the chart, so look below, and your weight. So if, for example, you're 5'3" and weigh 152 pounds or more, then you're at risk, so you would get 5 points for that. Are you younger than 65 years of age and get little or no exercise in a typical day? You would get 5 points or 0 if that's not true. Are you between 45 and 64 years of age? If yes, you get 5 points. If no, 0 points. Are you 65 years age or older? You get 9 points if that's a yes, or 0 if that's a no. So go ahead and add up all your points. If your points is between 3 and 8, this means your risk is probably low for having prediabetes. This would mean that you're active most days, that you're not smoking, you're eating low-fat meals with fruits and vegetables and whole grain foods. But if you do have high cholesterol or high blood pressure, you still might want to talk to your physician about your risk for developing type 2 diabetes. If you have 9 points or more, then you are at risk for having prediabetes, and I would make an appointment with your doctor to discuss these and get some blood work done maybe. If you don't have insurance, you can go through the health department, set up an appointment with them to be tested. Just make sure that you follow through sooner than later. Does anybody have any questions about that before I move forward? No? Okay. So how is diabetes and prediabetes diagnosed? Your doctor might do a blood test called a fasting blood glucose, meaning that you wake up in the morning and you haven't had anything to eat. If your numbers are higher than 126, you're more inclined to be diabetic. If they're between 100 and 125, there's your prediabetes. If they're 99 or lower, then you're within normal range. More typically, I see physicians ordering a hemoglobin A1C test, which would be to the right of your screen. 6.5 or higher is a diabetes diagnosis. 5.7 to 6.4 means you have prediabetes, or below 5.7 is the normal range. So what that A1C or hemoglobin A1C test is a percentage of how much sugar has been stuck on your red blood cells over the last 3 months, and that's where they get that estimated average from. So there's 10 tips that I can offer you today about preventing type 2 diabetes. Getting more active. If you're not very active, start now. It doesn't take a lot of work to do that. Start with 10 minutes of getting your heart rate up, just walking. Or if you have a bike, I know we're hitting the winter months. Sometimes people will go to the mall and walk around the mall, but you really get most benefit by getting your heart rate up for at least 10 minutes. Our goal is to get to 30 minutes a day. And if you have to break that up into 10-minute increments, that's okay. That's a start. If you don't want to go out, you want to be in your home because of COVID and everything, you can dance, put some music on and dance in your kitchen while you're making dinner. If you have children, playing with your children, going up and down stairs, things like that in your home. The next thing we want to concentrate on is eating healthy, and we'll talk a lot about that today. Coping with triggers that may cause you to not want to start to get active, or maybe a trigger that you eat to find comfort or things like that. Start paying attention to the reasons why you're not being able to be active or eating healthy or going to the doctor to get checked, and start eliminating those triggers. Managing stress. We want to pay attention to what causes our stress. If we're stressful every day, make sure that you have someone to talk to, go on a walk, listen to some calming music, things that you can do to alleviate some of that stress, to find some balance. We want to keep our heart healthy, and part of that is through exercise and eating good, healthy foods. Take charge of your negative thoughts. Get a support system going, someone who is willing to work with you to start some healthy habits. Stay consistent. That's important. We don't want to go longer than 2 days without being physically active. and staying motivated. Find something that will help you want to stay on that right path. So reversing prediabetes is through a lifestyle change. If you haven't gathered with all the things that I've been talking about, number one thing is try to lose some weight, between 5 and 10% of your body weight. Getting some activity in at least 5 days a week. Start slow if you haven't done anything. And again, eating a healthier diet and stop smoking. And we're going to go into detail on all of these. So for example, 5 to 10% of your body weight loss, if you look on this chart here, if you weigh 175 pounds, that would mean you need to lose 9 to 18 pounds to reach that 5 to 10%. If you weigh 250, you would have to lose 13 to 25 pounds to get that 5 to 10%. I'll let you look at that for a minute and then I'll change slides. Okay, so let's start with physical activity. I already told you 30 minutes a day of moderate physical activity. So moderate activity is something that gets your heart rate up. You don't have to run a marathon, but at least get that heart rate going. Walking, stairs, a bike, dancing, things like that. Or go to the library and rent out exercise tapes for Pilates or yoga or something like that. Or go on YouTube if you have a computer. And our goal is, again, 5 days a week. But again, start out slow. Check in with your doctor when you go in there if you haven't been exercising, so you can get cleared from him to make sure your blood pressure is okay and you're in line to be able to exert yourself. That's what I was going to say. Start slow. Okay. So along with physical activity and your weight loss, that alone can prevent diabetes 58%. But really the combination is activity and food. So eating healthy, we want to eat 3 meals every day and not skipping meals. A lot of times when I'm talking with my patients, I find that breakfast is skipped or lunch is skipped, or you're going longer than 4 to 5 hours without eating. And that really is hard on your body. Your liver will start sending sugar to your bloodstream if it feels like it's starving. So then your insulin, your hormone insulin, is working harder to get the sugar out of your bloodstream. If you're eating more consistently without going longer than 4 to 5 hours between your breakfast, lunch, and dinner, then your insulin can keep up with that and you feel better. Typically what happens when you skip a meal, you're so hungry by the time you get to the next meal that you eat more than what you should, and that also puts a lot of stress on that hormone insulin to help get that glucose out of your bloodstream. Choose a good variety of foods when you're looking at your plate. And we'll go into great detail on that in a minute. Listen to your body's hunger and fullness signals. Stop when you're feeling full. You don't need to keep eating. Your body's letting you know. So we like to use the MyPlate. It's an easy way to know that you're getting a balanced meal and well portioned. If you see on here, the plate is broken into different categories. If you can think of a fist size for your fruits and your grains and your proteins, and about 8 ounces of milk or 6 ounces of a light yogurt. That's about where we're going for. You'll see that the vegetable in the corner of the plate is a little bit more than a fist size, and that's okay. The non-starchy vegetables, green and yellow and orange, make it colorful. There are a few vegetables that are starchy vegetables that do influence your blood sugars, like peas, corn, and potatoes. On those portions, I would try to still keep to a fist size or smaller, especially if you're having grains with it, because those do influence your blood sugars and weight gain. Doesn't mean you shouldn't eat them, because there's a lot of good nutrition in them. Just watch how much you're eating of that on your plate. You can go to choosemyplate.gov and they can help you with your body weight, age, gender, and height, figure out how many calories a day you should be consuming, and they have lots of recipes on there as well. So when we're looking at the different types of foods, there are foods called carbohydrates that break down into sugar, and you'll see here on the slide grains, beans, and the beans that they're talking about are your lentils, and peas, and other vegetables like the potatoes and things that I just talked about, fruit and yogurt, those all convert into sugar. But our bodies need sugar to function. That's our main energy source. So if we cut out carbohydrates, then we're not getting any energy. So we do still need carbs. We just want to be mindful of how much we're putting on our plate. And if you can think fist size, that's a good place to start. Proteins are also important when we're trying to eat a balanced diet. The meats that we're looking for are lean meats, chicken, poultry, or sorry, pork, and lean beef. You don't want to eat beef every day, but maybe a couple times a week for your heart. Healthy seafood, fish, and things like that. Beans, like your lentils, they are also carbohydrates, but they're protein as well. Eggs and nuts and seeds like that. Remember, fist size. Proteins are kind of an important food because it helps balance the other carbohydrates and things that you eat so you don't get such a peak in your blood sugars. It kind of keeps it a little bit more steady so you feel fuller longer, as well as high fiber foods. So don't skip on your protein. If you're not a meat eater, you can find protein in cheese and eggs and nuts, or soy or something like that. When we're looking at fats to maintain our weight, we want to look at fats that are not saturated. So saturated fats come from animals like your butter and mayo and things like that. Try to do avocado or canola oil or something when you're cooking instead of the saturated fats if you can. So foods with carbohydrates that you can see on this slide. There's a lot of good choices on there. It's colorful. There's some not so good choices over on the right side, but that doesn't mean you have to go without treats, just sparingly and keep them small, right? Better to have a sweet if you're eating them so that other types of foods can help. Do you have a question, Connie?
To not be talked to.
Okay, sorry. And then you'll see your peas and corn on there, that they're starchy vegetables. Again, remember, not avoid the healthier choices when it comes to carbohydrates. You still need carbohydrates, just fist size amounts. Foods with little or no carbs are your non-starchy vegetables up at the left, and your proteins in the middle, your meats, and your cheeses, and your cottage cheese. So some of you might be thinking that dairy was on the other side. We saw milk. So what does that do to the cheese and the cottage cheese? Well, when your dairy is solidified in a cheese form or a cottage cheese form, your body breaks it down more like a protein. So it doesn't really raise your blood sugars. It helps stabilize blood sugars a little bit better. So we put them in the non-carbohydrate protein section. And you'll see nuts on there. A lot of times people go overboard on nuts because they're generally healthy, but there is a lot of fat in nuts. If you keep eating them all day long, it does add up. So a serving size of nuts is about the palm of your hand or a fourth of a cup. So what should we eat more of? This is kind of a long slide. More fiber. Fiber is a good food. It doesn't raise our blood sugars. It has a lot of nutrition in it. You'll find that in whole grains or in our non-starchy vegetables. So when you're looking at breakfast cereals, look for ones that have more than 3 grams of fiber in them or made of whole grains. All the other cereals, we call them fluff. Oatmeal is a good choice, unless you're buying the oatmeal that's prepackaged with the added sugar in it. That can add a lot of extra calories and gain weight, raise your blood sugar. So when you're doing your own oatmeal, it's better to do that and then add some of your own fruit to sweeten it up some. Or whole grain rice, like your brown rice. Some people are not really into brown rice. So some people mix it with white rice and the brown rice so that they can get accustomed to it if that's something that you want to try. Your whole breads, your tortillas, your lentils are great. It's a magical food. Remember, it's a carb and a protein. You want to make sure that you get your servings of fruit in every day. Fresh is good. We're heading into winter, or we're already there. So canned vegetables and fruits are a little bit more likely to get because the fresh is harder to get. Just make sure that you're rinsing off the juices from the cans. Your vegetables are loaded with a lot of sodium, and the fruit is loaded with syrup. So make sure that you find the light and you rinse it off with water. And I think there was a question, but I didn't get to see it, Trudy.
So there was a question earlier. If the A1C is low or normal, but the blood glucose is above 100, then I'm thinking that they must be wanting to know if that's still at risk.
Yes. So an A1C is a 3-month estimated average of what your blood sugars have been doing over the last 3 months. And your 100, if you just had a fasting blood sugar and it's 100, then you are at risk for developing type 2 diabetes because it's elevated without eating any food. However, if your blood sugar was tested after eating and it's 100, then you're probably okay. So the timing of testing your blood sugar is really important. But I would say that I would go off your A1C more because it's what's happening in the last 3 months. But your blood sugar check is what's happening right now. So be aware of, what am I eating? Am I active? What are the things that I'm doing in the day time? Does that make sense?
Yes, thank you. And then there was another question. It says, from what I've seen, pinto beans are very high in carbs, even though they have high fiber. Is that right?
Yeah.
And are these still okay?
Yeah, they're great. They're a carbohydrate type food and a protein, and the fiber. So they're all good for you. Just make sure that when you're eating them, you're eating a portion size. So a portion size would be less than a half a cup, 1/3 to a half a cup of your beans. But they're a great healthy food. Perfect food. Hopefully that helped.
Perfect. Thank you so much. We don't have any other questions at this time.
Okay. So the other part of the slide is eating plenty of vegetables. Make it colorful. Broccoli, spinach, dark veggies are great. Orange vegetables are good for you. If you're still hungry after eating your balanced meal, like we saw before on that slide where it's kind of divided into fist sizes, it is okay to go back and eat more vegetables. So keep that in mind if you're still hungry. All right. What food should we eat less of? So fruit flavored drinks and sodas and sweetened coffee and tea are all loaded with sugar. So anytime that we're dealing with sugar, that puts the weight on and it puts more work for our insulin to do its job. So if we have a problem drinking regular sodas right now or fruit drinks or things like that, then maybe make a goal of eating less of it until you can get it out of your diet. The thing with changing a lifestyle is you want to make small choices, like not choices, small goals so that you can check them off. Because if you you listen to today's presentation about changing your lifestyle and you become overwhelmed, more than likely it's because there's too much you got to do and then we don't do it. We start making excuses. So if soda is one of the things that you are struggling with, cut it back. Instead of having one a day, have one every other day until you get to the point where you eliminate regular sodas from your diet. We also want to eat less salt when we're cooking. A lot of foods have salt in them. The sodium affects our heart, and diabetes and our heart are like best friends. So what affects one usually affects the other. So high processed meats, canned vegetables, canned meals, and things like that have a lot of sodium in them. Pickles do too. So kind of be aware of that. It doesn't mean you have to eliminate it out of your diet, but be aware we should eat less of it.
Jennifer,
So this is really healthy. Yeah.
Sorry, Jennifer, we also have a question about what about diet soda?
Yeah, so diet soda doesn't have any sugar in it. And it is safe, but like all things in moderation, right? I usually tell my patients not to have more than 2 cans a day if they can of the diet, just because everything should be in moderation anyway. Good question. Any more?
No, you.
Okay. I'm good?
Yes, you're good.
Okay. So this is what a healthy plate looks like when you're trying to eat balanced. You can kind of see where the lines are, fist size of your starches. You can see the rice on the left, your protein up above the rice, and your non-starchy vegetables off to the left. And above the vegetables is fruit. So usually we consider a serving size of fruit a half a cup if it's cut up, or the size of a tennis ball if it's an apple or an orange or a pear or something like that. And then also, we don't see this on the slide, but you can also have a dairy with it. So 8 ounces is a glass of milk, or 6 ounces of a light yogurt with your meal if you want to, and that would incorporate a healthy meal. When we're looking at our milks, a lot of people ask me, is whole milk okay? They don't really affect your blood sugars any differently from whole milk to skim milk. It's the calories or the fat. So the whole milk is going to have more fat in it. And if you're trying to cut back on calories, you want to go down like 1%. Skim milk is what we're looking for. And the reason why we do light yogurt is because of less sugar. So milk is a lactose, so it has sugar in it anyway. The right, there is another meal if you're not super hungry and you just want to eat light. So you're not skipping a meal and you're getting something. You'll see the portion of cheese is about this size, or 1 ounce. It's typically a good way to look at it, like a string cheese. Your crackers is your starch. Your non-starchy vegetables is above, and then it looks like they're having a light yogurt with your fruit mixed in. So that's a lighter version. Questions before I move on? Okay. So when we're talking about meal plans, there's really not a one size that fits all, because we're all different. We all come from different families. We're all different sizes, different heights, different ages. So keep that in mind. What works for one person doesn't always work for another person. And we have dietitians here at St. Mark's that you can make appointments with and talk about meal planning, even if you don't have diabetes. It's called a nutrition therapy visit, and insurance does pay for it. You'll have to check with your insurance on how much, but do keep in mind that there's just not one diet that fits all. And I don't really like to use the word diet, so I'm going to call it a meal plan, okay? So there is the best diets or meal plans in the world, US News, and they update it every year. And the categories that they go through is how easy it is to follow, short-term weight loss, long-term weight loss, nutritional completeness, safety, preventing and managing diabetes, preventing and managing heart disease. These are the categories that you can look at and that they take into consideration. There's always so much information about meal planning that it gets confusing, right? But remember, not one fits all. So maybe if you have some time, look up the US News and World Report for 2020, and you can see on there the best recommended diets or meal plans. Right now, it's Mediterranean and DASH diet. So DASH means dietary approach to stop hypertension, which is blood pressure. And the Mediterranean, they're pretty similar. It's low salt, low fat, high fiber types of foods, kind of what you see in the picture. And that's just good nutrition for anyone. So if you're using the plate method that we were talking about, and you're getting a good variety of different foods, 3 meals a day, then you should be seeing some weight loss and overall general health and wellness, because those types of foods are going to prevent hypertension, high cholesterol, and weight gain. We have a whole seminar on meal planning, so I'm going to leave it at that. So I thought this was pretty funny. Now, I guess now we're into 2021, but sometimes when you're shopping in the stores and you can't get your bags open, I start thinking of these people because of COVID. That's just a mental break for you right now. Okay. Before we move on from food, is there any questions? Okay, so coping with triggers. Even if you have a set plan for a healthier lifestyle, we're in January and we're thinking about our health and we want to make some changes. Life does get in the way. And like I mentioned earlier today, there's triggers that are going to get in your way, and we're not going to always want to be active. So start thinking ahead. If you're the type of person that likes to snack while watching TV, make sure that you get a portion size. So don't take the whole big bag with you. Portion out what you're going to eat and watch TV if that's how you decompress. But try not to take your big size of chips, big bag of chips, and sit there and eat it, because you'll end up eating the whole thing while you're watching. If you eat because you're bored or you're emotional, find other coping strategies like going on a walk, calling a friend, taking a bath, listening to some relaxing music, something that's going to help cope with those triggers. Or managing stress. So stress can lead to type 2 diabetes. It changes your body chemistry, actually. So everybody's stressed at some point. We're stressed every day and different things happen. So the things that we can do to balance our stress is to ask for help and do something fun. Take care of yourself, right? Take a little bit of time for a YOU. Go on a walk, meditate, recognize what the stressor might be before the situation gets out of control. Getting enough sleep. So sleep difficulties has been associated with diabetes, a 22% increase, believe it or not. It is recommended that you get 7 to 8 hours of sleep a day. And it's kind of hard to do sometimes with the older we get because we have so many responsibilities. But it is helpful to set a schedule so that your body knows when it's time to wind down. If that's turning the lights down, turning off the TV, taking a warm bath, lighting a candle, whatever it is, something that's going to be a routine for you to help you calm down so that you can get enough sleep in the day. And there's a lot of apps on your phone too and your watches that can help get sleep or help you get ready for sleep. This is kind of funny. If your partner snores, get high quality earplugs. That's how it is at my house. All right. Taking charge of your thoughts. Harmful thoughts will delay your success in changing your lifestyle. Make sure that, and I talked about this briefly, come up with an action plan. Write down small goals that you can achieve. We call them SMART goals. Something small, measurable, something that you can obtain, that you can achieve in a timely manner. Make sure that you set up time. So for this week, for 5 days, I'm going to go on a walk for 10 minutes or something like that. Or this week, I'm not going to have a soda every day. I'm going to have a 12-ounce can every other day. Instead of getting discouraged, try to replace your negative thoughts with encouraging ones. So instead of saying, I can't have this piece of cake, say, I'm going to have a smaller piece of cake or something like that, to try to replace that negative thought so that you can keep going to make some of your goals for the year. If you have depression, get help, because depression is very hard to manage, a lifestyle change, and you might need some tools from a professional to help you get started. So smoking and diabetes is kind of a big deal. Smoking decreases the absorption of insulin, so you're more insulin resistant. Remember, I told you that your insulin gets tired the older you get, or if you've been overweight, or if you're a smoker, or if it's in your genetic makeup. If this is the case, you might want to consider calling the Utah Tobacco line. They have an English line or a Spanish line to help you get started. Smoking has proven to show that you have more problems with belly fat, cholesterol, and blood pressure, which also affects the development of diabetes. Also, smoking speeds up the progression of neuropathy, so numbness and tingling in your fingers and toes, kidney problems, and eye problems. It also leads to heart attack and erectile dysfunction. So if this is something that is hard for you, this might be a good goal, and there are some helplines down there on the bottom. So support, so get encouragement from your family members and your coworkers. Nothing's worse than going to someone's house and they keep pushing you to do something that you don't want to do when you're trying to make some changes. But more than likely, friends and coworkers might want to join a support group, maybe a walk group at lunch or a recipe swap or something like that. There's also the National Diabetes Prevention Program in our area. Um, Salt Lake has, through the health department, they have one. There's also apps on your phone that we talked about. The choosemyplate.com also is a good place to start to get recipes, and you can monitor your activity that way as well. There's all the information for your Living Well .utah.gov. That's the prevention program. Here at St. Mark's, we have healthy lifestyle classes that we offer every other Wednesday at 5:30. You just need to call to reserve a spot. And right now, because of COVID, they're all virtual, similar to this. We talk about a lot of things: healthy eating, exercise, stress, a cooking class, anything. There's a whole schedule. So I encourage you to look at weightlossutah.com and kind of look at what we have as far as our virtual classes this year. Again, we have our dietitians here. If you're not diabetic, that can help you with meal planning. It's called Nutrition Therapy, and you can just call us. That same phone number that is on that site. It goes through your insurance. And then there's also the Utah Department of Health resource line, the number that's listed there. I'll leave that slide up for a minute if you guys want to write down anything. So while you're writing things down, are there any questions thus far? Okay, I'm going to move on. Just remember, we talked about a lot of things today, healthy lifestyle changes, whether it be with exercise, food, stress, getting positive thoughts, finding a support system. There's lots of things that we can do to make ourselves have a healthier life, right? But remember, sometimes it's the smallest things that change your life forever. So try not to be overwhelmed with the scope of everything, but pick something that maybe we talked about today that you can work on, and you'll be all that much better for it. If you scored high on your risk assessment, make sure that you contact your doctor so that you can get some blood work, get your blood pressure checked, your weight and your height, and kind of see where you need to be. There's no time like now to start, right? So that is all I have. So if there's any more questions, just let me know. I thank you for your time and your willingness to get online.
Thank you, Jennifer and Kim with St. Mark's for doing the presentation today. While we're waiting for questions to come through, if you have not done so already, there's a link that's been posted for you to receive your 10 healthy lifestyle points for joining us today in this presentation. Looks like we just had a question come through. Why do the older people get 9 points on the test?
So the older we are, the more insulin resistant we become. That's just life because our body's been using insulin for its whole existence, right? And so age plays a big role in type 2 diabetes. And then the other risk factors, so if your family has it, you've been overweight around the abdomen area, that puts your risk even higher. So you get more points because you're older because of that insulin resistance that's already happening, whether you have diabetes or not. Was that helpful? It's hard when you can't see facial expressions.
That is so true. It's the one difficult thing.
Yeah, but it's neat that we can do this though, because it's nice to be able to connect with the public still.
Yes, and I really appreciate you posting the programs that you offer. That is very helpful.
Yeah, they're great, and they're all online again, so there's no reason why you should miss it.